Hello friends, here I like to share some ideas on home care of a COVID positive patient. I'm not here to talk about the legalities, but about the basic medical insights into the management. There are two aspects. One is avoiding the spread of infection from the person who has COVID to those who do not have, and the other is to monitor the patient who has COVID so that we can pick up any deterioration early and take institutional help. The most important thing which spreads the infection is proximity. So keep distance. And why? Because with every act of breathing, the virus is exhaled out of the respiratory system and stays in the air in and around the patient. The distances reached by the virus only increases with talking and even more with coughing and sneezing. So if you are in and around, the air is infected and you inhale, you are likely to become infected. Keeping distance really helps. Let them stay in a separate room. If you really have the urge to talk to them, call them on the mobile. But do not be tempted to come physically close to them. The second is sanitization. Once the virus has come out of the system, it might stay in the air for some time, God knows how long, but then it will settle down on all the objects around. And that is the role of sanitization. Probably we have gone mad with the idea of sanitization because it's very, very difficult. Sanitizing almost everything, gadgets, clothes, furnitures, very, very difficult. But we got to know that from the surfaces, the virus will still enter your body through the respiratory tract. And here, the source is your hands. You will touch those contaminated surfaces, the hands will come close to the face, and you can catch the infection. That is where the role is of sanitizing your hands, the easiest job to do. So whenever you touch things which probably would be contaminated, or maybe you can do it as a regular routine, wash your hands, either with an alcohol solution or with soap and water. And the third is wearing the mask, because the distance this virus travels decreases significantly if the affected person wears a mask. And if the caretaker also approaches them with a mask, the viruses may not find it very easy to cross the barrier and enter into your respiratory system. So both the caretaker and the affected person are encouraged to use the mask, especially when they come in close distance because of whatever reason. How to monitor these patients? Well, oxygenation is one by a handheld pulse oximeter. I've already described it, and we take 93-94% as the warning levels, below which if the oxygen falls, you should report. Also, you can do a 6-minute walk test. So you're not just checking the oxygen level at rest, but you take a gentle walk, count maybe 5 to 6 minutes, and then check your oxygen levels. If the oxygens are falling, it's an early sign. So your oxygen levels may be maintained at rest, but on little activity they start dropping. That tells you that probably your lungs are not getting adequate oxygen. You can also check the respiratory rate. Just look at the movement of the abdomen per minute. Normal breath rate is around 10 to 12 per minute. And when the breath rate increases to more than 24, it becomes a moderate disease as per the medical classification, and more than 30, it's severe disease. So along with the check on the oxygen, you also check respiratory rate, very, very simple, and temperature. Most of us have become used to using those infrared thermometers, but use them correctly. They have to be kept very close to the skin, maybe an inch distance or so, and focus on the forehead. If there is any sweat or water, wipe that off and then take the temperature. In Fahrenheit, anything 99 and above would be considered as having fever. So you can monitor that as well. The patient will require all kinds of care. He may have to be fed, he may require his clothes, bathing facilities. Make sure that he can have everything at his disposal, and you do not have to go and contact the person every time to provide them all. Make a plan that you can keep distance and as well as stay connected. And the other thing is staying connected with a healthcare facility, a healthcare provider, so that in times of need medical care is not delayed. You can rush to a medical professional, a hospital where have availability of bed, because all these are going to become very crucial, especially availability of critical care beds. So stay connected. That what the government also wants you to stay connected. Make sure you put all your measures, keep emotions apart, and keep physical distance, avoid the spread of infection, do very basic monitoring, and pick up early deterioration and reach healthcare facility. There are so many packages now available. I don't know if you really need them. Those gloves, whether you wear gloves or you don't wear gloves, your hands have to be sanitized. They have to be clean. If the gloves are contaminated, they also cause spread of infection. Masks probably one of the best ways to protect both self and the other. So learn the appropriate use of the mask and the appropriate disposal as well, because those masks are now infected surfaces. They are also like fomites. And beware that things can go wrong. We give you a period of around 10 days now to recovery, and another 2 weeks of home isolation, so that we decrease any risks of transmission of infection from the person to someone else. And as we know, many patients can have no symptoms and can still lead to spread of the infection. So it is common to consider everyone around you as infected and take all precautions. And when you already know that a person is positive, you make sure that you take these steps even more earnestly.